Hello and warm greetings to all dear readers. Allow me to extend my heartfelt wishes for health and respect to each of you. In our later years, natural, effortless breathing and steady steps are no longer guaranteed. And that is why today we will take a detailed, comprehensive look at chronic obstructive pulmonary disease, commonly known as COPD, here in the United States. This piece is crafted as one continuous narrative so that you can feed it directly into an AI voiceover without any breaks. COPD is a group of chronic lower respiratory diseases, primarily including chronic bronchitis and emphysema. In chronic bronchitis, the bronchial lining is constantly irritated, leading to excess mucus production and prolonged coughing. Emphysema is characterized by destruction of the alveolar walls and loss of lung elasticity, which reduces the surface area for gas exchange. These two forms often coexist, narrowing the airways, trapping air, and causing persistent breathlessness. According to the U.S. Centers for Disease Control and Prevention, CDC, about 16 million American adults have been diagnosed with COPD, but the true number is much higher, as many early cases go unrecognized. COPD is currently the third leading cause of death in the U.S., with more than 150,000 deaths annually. It is also a primary reason for hospital admissions and reduced quality of life among older adults. In the early stages, symptoms like a mild cough or shortness of breath when climbing stairs are often mistaken for normal aging, rather than warning signs of weakening lungs. So why does our lungs, the vital organs that sustain life, become irreversibly damaged? And how can we recognize the signs before it's too late? To answer these questions, let's examine each of the main causes of COPD, starting with smoking. Smoking remains the number one risk factor in the U.S., accounting for roughly 80 to 90% of COPD cases. Cigarette smoke contains over 7,000 chemicals, including more than 70 known carcinogens and numerous potent oxidants. Every time you inhale, billions of microscopic particles adhere to the bronchial lining, triggering chronic inflammation, increased connective tissue growth, and progressive airway narrowing. Even after quitting, former smokers continue to experience lung damage because the structure of the lung tissue has already been altered. Secondhand smoke, too, is a silent killer. It's estimated that around 7,300 COPD-related deaths each year in the U.S. are linked to secondhand smoke exposure. In many households, especially in areas with low tobacco taxes or lax smoke-free policies, people still smoke indoors or in cars, causing significant harm to elderly family members and children. Air pollution is another major contributor. The U.S. Environmental Protection Agency, EPA, reports that large cities like Los Angeles, New York, and Houston frequently exceed safe levels of PM 2.5 and ozone. Fine particulate matter, PM 2.5, measuring less than 2.5 microns, penetrates deep into the alveoli and bloodstream, causing localized inflammation and damaging the protective epithelial layer. Each bout of coughing or chest tightness induced by polluted air further injures lung tissue, gradually diminishing respiratory function. A sedentary lifestyle also accelerates COPD progression. When the body lacks physical activity, the diaphragm, the primary muscle of breathing, becomes less efficient, altering both vital capacity, VC, and residual volume, RV, in an unfavorable direction. U.S. pulmonary rehabilitation programs have shown that sedentary individuals have lower endurance, experience greater breathlessness, and find diaphragmatic breathing exercises more challenging. Nutrition plays a supporting yet significant role. Deficiencies in vitamin C, vitamin E, beta-carotene, and minerals such as zinc and selenium weaken the body's antioxidant defenses, making lung cells more vulnerable to oxidative stress. Conversely, consuming excessive refined sugars and saturated fats promotes the release of pro-inflammatory cytokines, deepening systemic inflammation. Research from the National Institutes of Health, NIH, indicates that a diet rich in vegetables, fresh fruit, and whole grains can lower C-reactive protein, CRP, levels and improve respiratory function in older adults. Occupational exposures. Long-term contact with wood dust, asbestos, silica, or industrial chemicals also quietly destroy the lungs. Workers in sawmills, mines, construction, and steel mills who lack adequate protective equipment have a 2 to 3-fold higher risk of developing COPD compared to office workers. To address this, federal and state agencies are tightening workplace safety regulations and mandating ventilation systems and personal protective gear. Genetics cannot be ignored either. Alpha-1 antitrypsin deficiency, affecting about 1 to 2% of U.S. COPD patients, reduces the body's ability to inhibit elastase, an enzyme that breaks down elastin in lung tissue. As a result, emphysema can develop even in non-smokers. Genetic testing and alpha-1 antitrypsin replacement therapy are emerging treatments at major medical centers, although cost remains a barrier. Thus, COPD in the United States arises from a combination of factors: smoking, air pollution, nutrition, lifestyle, occupational hazards, and genetics. Understanding these mechanisms empowers us to take proactive steps in preventing and managing the disease effectively. In the next section, we will explore comprehensive medical treatments, pulmonary rehabilitation, and lifestyle modifications to help control COPD and enhance quality of life. Once these root causes are clear, the next step is to implement a holistic management plan. First and foremost, work closely with a pulmonologist to personalize your treatment regimen. Inhaled bronchodilators, both short-acting SIBA and long-acting LA, are essential for opening airways and relieving breathlessness. For moderate to severe cases, inhaled corticosteroids may be added to reduce airway inflammation. Adhering strictly to prescribed dosages and schedules is crucial for minimizing exacerbations and preventing further lung damage. Home oxygen therapy is indispensable for patients whose resting SpO2 falls below 88%. Maintaining stable oxygen levels eases cardiopulmonary strain, improves sleep quality, and enhances overall mobility. Patients should be trained in safe oxygen tank handling, replacement schedules, and equipment hygiene to prevent infections. In very severe cases, lung volume reduction surgery or lung transplantation may be considered, although these complex options are reserved for carefully selected candidates. Alongside medical treatments, pulmonary rehabilitation, PR, is highly emphasized in U.S. healthcare settings. A comprehensive PR program includes diaphragmatic breathing exercises, pursed lip breathing, and endurance training with stationary bicycles or treadmill walking. Under the supervision of respiratory therapists, patients learn proper breathing techniques, strengthen the diaphragm and intercostal muscles, and reduce breathlessness during exertion. Educational sessions on COPD management, early exacerbation recognition, and home symptom control are integral components of PR. Nutrition support should be tailored by a registered dietitian following U.S. dietary guidelines. Underweight patients need higher quality protein from fish, eggs, low-fat dairy, and plant-based sources to maintain respiratory muscle strength. Overweight patients require calorie control, favoring fiber-rich foods, vegetables, and fresh fruit, while limiting saturated fats and added sugars. Adequate hydration, about 1.5 to 2.5 liters per day, helps thin mucus and facilitates expectoration. Your living environment also matters. Use an air purifier certified by the Association of Home Appliance Manufacturers, AHAM verified. With a HEPA filter, avoid burning wood or coal indoors, and choose cleaning products free of volatile organic compounds, VOCs. When venturing outdoors during high pollution days, wear an N95 mask and check the airnow.gov air quality map to plan safe exercise times. Quitting smoking entirely is non-negotiable. Those who still smoke can utilize the CDC's quitline support or nicotine replacement therapies recommended by healthcare providers. Family and friends play a vital role by maintaining a smoke-free home, offering encouragement, and supporting each other through the quitting process. Annual respiratory vaccinations, including flu shots and pneumococcal vaccines, are recommended by the CDC to reduce the risk of respiratory infections and prevent severe COPD exacerbations. In case of an acute exacerbation, sudden worsening of breathlessness, color change in sputum, or intense coughing, use your rescue inhaler immediately. Increase your oral corticosteroid dose if prescribed, and take antibiotics if an infection is suspected. Keep your doctor's contact information and medication list handy, and seek emergency care if symptoms do not improve within 1 to 2 hours. Psychological support and community building are essential. Many American COPD patients join online support groups or local senior centers to share quitting tips, breathing techniques, and nutrition advice. Relaxation practices such as mindfulness meditation, gentle yoga, or therapeutic music listening have proven benefits in reducing anxiety, improving sleep quality, and bolstering immune function. For long-term monitoring, measure your SpO2 daily, upon waking and before bed, to detect early declines. Readings below 90% at rest or below 88% during mild exertion, like climbing stairs, warrant immediate consultation with your physician. Schedule follow-up spirometry every 6 months to track disease progression and adjust your treatment plan. Always bring your symptom diary, medication list, and note any weight changes, breathlessness levels, or side effects. Finally, although managing COPD can be a long and demanding journey, please hold on to hope. Every deep breath and steady step testifies to your resilience and determination. COPD does not mean the end of life's pleasures. With proper care, you can continue enjoying favorite activities, listening to music, reading, socializing, and creating precious memories with family. Wishing you peaceful breaths, enduring health, and an optimistic spirit. May each day be a journey filled with hope and meaning. Sincerely.